Hi, everybody. My name is Dr. Minh. I am an orthodontist, and today we are going to be actually going through the subreddit page of braces and doing some reactions of before and afters, possibly answering some questions. I noticed a lot of the questions that are on this Reddit page, which is just populated completely daily. I'm going to start this new series, if possible, how much I can keep up with this, as far as maybe giving like real life explanations from an orthodontist, where I do this all day, every day, and see if I can help some people out, answer some questions, and give some reassurance as far as whether or not the orthodontic treatment was beneficial. And I'm happy to help you guys out. But we're going to get straight into it, okay? All right. So this is the... So it was actually high school that actually introduced me to this page. Every day I kind of just like browse and take a look at this thing. So this is the braces subreddit page. Oh, and we're just gonna scroll down and see some general reactions and stuff. So here we go. Let's take a look at the first one. 4-month update with these brackets. Not too bad. Looking pretty good so far. So it looks like the top is 4 months later. This is the beginning side of things. What this person already initially started out with is actually posterior crossbite. And you can actually see it way back here. So let's compare the right side, how these teeth are actually on the outside of the bottom teeth. These teeth over here are on the inside of the bottom teeth. That's what we call a crossbite. Possibly a little bit of an anterior crossbite as well. Can't really quite tell in this bite right at the moment, but in just 4 months later, it is trying to derotate and stuff. So we take a look at the top teeth, nice broad arch wires to kind of develop the arch form. And you see the incisors here are slowly trying to derotate out. So this tooth has to rotate. And this, our view, is clockwise. This tooth has to go counterclockwise. And this tooth is grabbed on, and it's going to slowly creep forward. And just 4 months' time, this is pretty normal. Looking good so far. Keep it up. Let's keep going down. Final night in my braces. I'm sure this person's like thrilled. Looks like they have some sort of self-ligating system, fancy word for just saying instead of like color ties on the braces, they have these little doors that just kind of like close down. This system is self-ligating system. There are multiple kinds and very, very popular throughout the country and the world, where they claim to have very light forces, big broad wires, and try to do as much as they can. Like non-extraction is like the sales point for that one. First time getting braces at 33. Congratulations. I think it was a great option. I think at the end of treatment, you will be thrilled. Probably my guess is no earlier than 12 months to no later than like 24 months time frame of treatment. But congratulations. Very funny picture. Very cool. Congratulations again. 6 months in. Can't believe the difference. See here. Wow. Okay. 6 months ago, you can already see this front tooth, a little turn this way, this tooth turn this way, a lot of crowding going on so far to where, oh, you can blow this thing up. A little fuzzy, but teeth are lining up really, really nicely. Very, very good. Let's see what the comments say. See, the teeth move so fast. Thank you very much. Dental hygienists, they're commenting on how clean the teeth are. Really good. All right, let's see if we can find something wild over here. Some red dots here. Oh, I might skip that one. Oh, I like this one. Here we go. 20 months later for this patient's treatment. It looks like, again, another self-ligating system. There's no color ties on these, having to hold the wire in. And we look at the beginning, and this is where they're at 20 months in. They're probably getting close to the very, very end. But you can see this is a full-on, what we call anterior crossbite. It means where the top teeth are tucked in behind the bottom teeth, like so. And fast forward 20 months later, these teeth now overlap the bottom teeth. And I believe the comments on this one were really, really good. Here, let's check it out. Oh my God, that's a crazy transformation. Congratulations. Did you have to get teeth extracted at all? Yes, I had 4 premolars removed. So what this means is it's very, very typical when in certain cases where premolars have to be removed. Yes, they are actually like perfectly healthy teeth that are used in normal everyday usage and eating and function. But sometimes space is just space, and crowding is crowding if it is severe enough. So the most important teeth in a smile are actually canine to canine right here, followed by you have two premolars and then their molars. And it is a common thing to where premolars would have to actually be extracted. So in this case here, this patient had to have most likely top premolars extracted. So the teeth behind these teeth or the ones behind those. So it's either this one or the following ones behind it have to be extracted. And to prevent, you can't just extract on the top in this case, because in that case, these teeth would have to go back. The tendency is these top teeth would actually retract more into your face. So you have to actually extract teeth on the bottom as well to create and eliminate your crossbite to go from here to here. No, the results are wonderful. Just looking at the smile alone, unless the Reddit user actually commented or did not comment about premolar extractions, is sometimes very difficult to tell, especially with the braces on. So really good, huge change. Congratulations. Hopefully you are getting close to the finish line. Done here. This person's just thrilled that all the attachments or braces are completely off. Wonderful, great result. Let's see here. Okay, here's a good question. Should I get my teeth extracted? Based on, so they're indicating these premolars here. It looks like they already started treatment. Here we go. My orthodontist says I need the teeth, which have a marked in blue, extracted as my mouth doesn't have enough space. And apparently my gums are receding, so they might fall out when I'm older. Also said to take two teeth at the top as well. I'm 15 years old. So what he's trying to say is there's a lot of crowding on these front teeth combined with recession. So possibly these front teeth right here, where the gum line is actually starting to like come down and expose the teeth more and the roots. If you were to, let's start over. Let's say you just put braces on in this case. So what the orthodontist is trying to explain is, if you just put braces on across this case, the natural thing that the teeth will do is actually completely procline. It'll push forward unless you create space somewhere. In this case, the recession and the crowding is so severe that the orthodontist said, hey, let's take the teeth out that are not quite as important in your smile. So these way back premolars here, these back premolars here. With this extra space, all the crowding will be relieved, as well as getting the lower teeth centered in bone down here. The only way you can really tell, you can't really make a final confirmation as far as what this patient should ultimately do unless you have full records. Particularly, you need what's called a lateral ceph. So you probably took an x-ray that kind of goes sideways and you see like your whole head, top jaw, bottom jaw, and the angulation of your teeth. My guess is the angulation of your lower teeth are like pretty far forward. So you combine tipped teeth out along with crowding. The orthodontist felt that in order to create a wonderful smile, you have to actually take out two premolars in the back, pull everything back, eliminate all the crowding. And to match it, you would have to actually take teeth out on top as well, so that you don't create this huge overjet, which just means these top teeth are so far forward in front of the bottom teeth. It's pretty typical. All right. Let's see here. Not really enough info to give good advice on what is available. What you have said, there is nothing unreasonable about proposed extractions. True. What he's trying to say is, and there's just not enough information just based on one picture. You would have to have complete set of photos. How do the teeth fit together? You have to assess the jaw positions, top and bottom jaw, angulation of the teeth. All those things come into factor before making a recommendation. Objectively speaking, I think most orthodontists, if they can help it and keep teeth in, they probably would. If teeth have to come out, that decision is not something that's made like really lightly to create a wonderful smile for you. I think you'll be just fine. Here we go. 20 months progress, originally told 3 years, getting out soon. This is great. So what this patient shows in the beginning here, anterior crossbite, possibly a little bit of posterior crossbite. What you have is braces, and the orthodontist skipped the lateral incisors. What that means is pretty normal when there's like a severe amount of crowding. The orthodontist actually put in, looks like what we call coil springs. These little springs are like little sleeves that are attached into the wire and it like opens up space. It opens up space for the laterals to actually fit into the room. Basically, you're trying to push some teeth out of the way to fit other ones in there, so not squeezed out too much. Over time, this is 20 months later. Based on this picture alone, this is great. This user was originally told 3 years time frame, and this is where they're at right now. This person is thrilled at this point. You have wonderful relationship of the front teeth, overbite, overjet. Overbite is just fancy for saying how much the front teeth overlap the bottom. Overjet just means how much the top teeth fit in front, where you had no overjet over here. You were actually a little bit of negative overjet. And over here, this looks wonderful. You're running some triangle elastics just to help to get the teeth to like come down and fit together. Great. No, it looks really, really good. 20 months progress. Originally told 3 years. Getting out soon. Congratulations. Looks great. Few months to go left, and then they're off. Doesn't really say a whole lot. Let's take a look at 2 years progress here. Severe overjet. It looks like we have possibly some lateral incisors or something tucked behind here. I'm not quite sure what that is. Let's see where we're at. Yep, it's what I thought. So it looks like you had severe crowding on the bottom, severe crowding on top, and the doctor pulled back your canines, which would make room for your lateral incisors, which should fit right here in the next slide. Did another, again, we saw this earlier, a little open coil spring along the wire, open up space for this tooth. I mean, this tooth is completely like turned sideways. These teeth are kind of like shoulder to shoulder against each other, and this one's just like all turned weird. Let's see what the next one shows. Went too fast. Here we go. This is great. Actually, great example of some basic mechanics here. Spring. People wonder why. Oh, why did my doctor skip these teeth? Why didn't he put braces on there? There's not enough room. You have to make space first, then put some braces on there. Based on the lower tooth right here, it looks like there's enough space at this point. The doctor at this visit probably put some brackets on right on this tooth here, and then in one visit, whole thing should completely spin around. Looks like they're trying to make more space still for your lateral incisors. There we go. Now at this point, felt there was adequate space bonded up here. Pull those into place. Bam! Look at that one. Lower tooth, lower incisors straight, upper lateral incisors fits right in. Great. There we go. Basic mechanics. It's great. Is this normal? I wonder if there was a... Is this normal? There really wasn't much... Hold on. My braces are coming off next week, but I have these gaps between my tooth, which bugs me. Is this normal, or should I question my orthodontist? This is a really, really good question. What this is showing here is the orthodontist is just trying to put the tooth in the normal ideal position. My guess is it looks like this tooth is actually proportionally smaller than what it should be. Okay, so it's a little bit of what we call like a tooth size discrepancy. This tooth should actually possibly be, my guess is that it should be a little bit wider to fit in proportion to the teeth next to it. So the orthodontist right now, I think, is just trying to create some space for your dentist to most likely do what's called like, a buildup, whether it's a composite or veneers. And also, I think this orthodontist might be doing you actually really, really nice service to really, really complete your smile. If we look at this one, now let's take out the space here and here. What I want you to look at is actually the shape of your tooth. This shape is actually a little bit more conical, meaning like pointy cone shape. This is not normal for this tooth. You actually want this tooth to be a little bit more rectangular, but you notice the curvatures right here are just like a little bit high. This one's very, very high and scooped upwards. So not only, I think, would a dentist probably build up this tooth laterally, like on the sides to close the remaining spaces, but it would also be nice if it was shaped up and added some material to finish up these corners. Where based on this picture, you look at this tooth right here, it is like stuck, not stuck, but the shape of it is much more balanced and rectangular and curved in the right proportions relative to the front teeth. So this is pretty normal. Perhaps my guess is the dentist may or may, your orthodontist may or may not have mentioned it. But just bring it up, and I'm sure that's probably going to be it. Bring it up, ask them. But I'm pretty confident that's probably going to be the answer here. Scheduled removal. Are they ready? Let's take a look here. Big smile. Teeth are nice and forward. Let's take a look. Alignment looks good based on this picture. Your bite looks really, really wonderful. Looks like some finishing bends that the orthodontist was trying to do to get the teeth to kind of like all come together. Perhaps a combination of some rubber bands to help the teeth come in. Based on these pictures, I think it looks pretty good. You know, it's not a whole lot we're really going to change here. I think you're going to be pretty thrilled like when it all comes off. Let's see here. Day 1, 51 years old, and finally, top first few months, and we'll see what needs to happen with the bottom. Easy enough to put on and no pain yet. Day 1. Oh, this is day 1. Okay. They're finally off. All right, let's take a look here. So this patient started out with these incisors are kind of like a little bit low, crowding on the bottom, and the bite just needs to kind of come in together. Let's see here, zooming in. Already the smile is just like really, really much more well balanced along these front teeth. And these rubber bands kind of helping the bite kind of like come together. This is great, wonderful. What this person actually shows is like aesthetically, it looks really, really well done. You see like almost a full incisor display, top and bottom. Nice balance of the teeth. There's no crowding, no spacing. Well, my guess is the bite is probably pretty good as well. Congratulations. Was it removing my braces in 2 weeks? Okay. Some rubber bands, right? Oh, okay. They were just indicating right and left. Can't really entirely tell based on this picture right now. I don't know if they're completely biting down all the way or they're just trying to show the teeth. All right, I'm kind of embarrassed to show this, but how much time do y'all think braces would take to show progress with this one? Depends. Right now, the thing I'm really looking for is I can see that these front teeth kind of like stick out. How much do the bottom teeth stick out, if at all, is the next thing. So it looks like there's some space back here, but the braces probably initially right away when it starts to, you know, do its first work of trying to like level out your teeth and then get the teeth straighter, those top teeth will start to come back just a little bit. But for them to really, really crank it downwards, probably take a few months for them to be ready and a strong enough wire to actually apply things like a power chain or different types of springs or rubber bands to help get those top teeth to tuck backwards. And also like the bigger wires and the shapes will change the bracket or the braces, planned movements built within the braces to actually tip the teeth a little bit further back. Hard to say right now, but it shouldn't take too long. First day, a lot of anterior cross bites today right here. Anterior cross bite, some braces. Oh, here we go. 36 months later, some crowding. You see this wire pulling up like so. A lot of crowding on the bottom. Over here, you see how the wires just turned all sorts of ways, some train tracks. And then 36 months later, really, really lined up. This person is probably really, really getting close to the end. Officially 1 year in. Whoa. All right, 1 year update. This was just a few days ago, right here. Braces, teeth seem to be leveled, decently aligned, and he's using a series of rubber bands to bring the bite together. This is where he started. This is crazy. So this is November 2024, so a little under a year ago. This patient started with bilateral posterior crossbite, which basically just means that these teeth were tucked on the inside of the bottom teeth on both sides. What I assume is probably like, you know, adult male as well, along with an open bite. So these front teeth just like don't even touch together. I can imagine it was super, super hard to eat, function, and a lot of wear on these back teeth is really, really common for these kinds of cases. And right here, looks like the wires, maybe an expander perhaps, broaden up the upper arch and help straighten up the teeth. And along with a series of rubber bands and the wires itself are bringing the teeth together. No, this is great. 1 year progress. Totally see the difference. My guess is probably a heck of a lot easier to eat as well. Kind of answered this question earlier. Open bite, braces only. So patient has a good number of millimeters of an open bite here, where those front teeth just don't even touch together. That's super hard to eat. Wow. Okay. There we go. Slowly coming together. Oh, there we go. Look at that. Not too bad. Okay. It's coming together. Looks good. Yeah. I mean, yes, you have some, like you have an open bite right now. The good part is you actually have space. The space between the teeth actually plays in your favor. when you progress in the braces system and you move forward in your case, maybe some power chain to go with it, it actually will not just bring the teeth top and bottom together, but actually close the spaces as well and kind of bring everything back all together. I never actually see what this next side looks like. Let's see here. Oh, we did. Okay. Yeah, slowly coming together. Maybe a series of some rubber bands to kind of help get the bite to all come together. But no, it looks really good. Saw this earlier, saw this earlier, saw this earlier. Saw this one. Nice before and after right here. 15 months of progress. Not too bad. No, let's take a look. Let's take a closer look right here. A lot of space. My guy, a lot of space. Little posterior cross bite, big gap in the front. Thrilled to get to this point right here. I mean, just being able to function, eat. When the braces come off, he's probably going to have like some of the biggest smiles ever. No, it looks good so far. Arch wire is not in the slot. Here we go. I saw this a few days ago, and this kind of prompted me to maybe do like a Reddit reaction. Does anybody know what this process is called? Has anyone ever done this before? Yes, I know exactly what this is. This is actually what's called an intrusion arch. What he does is, so normally the braces are on and the wire is really, really straight across the board. But your orthodontist wants to actually most likely, I guess you have like a deep bite. So he wants these bottom teeth here to actually go further downwards. So to open up your bite. One way to do it without having to have any side effects towards the back teeth is to actually skip the back teeth and only tie in these front teeth here. So it has to be some sort of stainless steel wire, so like a stiffer wire is bent and inserted into your molars. It bends down, it comes up, and like so. To just the picture alone, you're going to think it's not doing anything. You're just tying it in. But what happens is before you actually tie it into these front teeth, my guess is this wire was actually way down here before it was tied in. So when you bend the wire, it is not activated. It passively comes down and actually rests into this lower gum lip area right here. Your orthodontist would then lift it up because the forces are actually bringing it down, or intrusion, and then ties in the 4 incisors on the bottom. So passively, it's resting down here. The doctor will lift it up, activating the wire, ties it into these teeth, and it's bringing those front teeth down. A little bit of an old school technique, but extremely effective. Still rather, really, really popular in the right hands especially. No, not entirely uncommon for this kind of case. Looks good. So it looks like we kind of seen like most of these already. I think that was just a nice first day of just doing some Reddit reactions. But that was good. Maybe we'll tune in another day, just kind of answer some questions again that I see on the Reddit page and help some people out. If you managed to watch it this far, thank you so much. Be sure to like, subscribe to my channel where I show things about my office and more Reddit reactions, perhaps answer any questions that you may have. And as we move on in cases, I'll be able to show like my own before and afters of case progress and how I like to treat my patients and how I like to finish my cases from a functional standpoint as well as an aesthetic standpoint. Thank you very much for tuning in. I'll see you guys soon. Bye now.